Thank you so much for taking the time for us, Dr. Joffe. I really, really appreciate it.
Well, thank you, Nancy. It's a pleasure to be with you.
And of course, this is a topic that a lot of people still have a lot of questions about. And I think there's something to be said about having questions answered directly from the source, as opposed to, I know I'm guilty of Googling plenty of things. So I think that it's so important that we are able to give this information to our audience as well. So I'll get started with some of the questions now. I have to start with a question that I know is top of mind for a lot of people. Have your thoughts changed on masks? We've just received a number of questions about them. Are the rules still the same for them? Are the guidelines still the same for them? Are you recommending that people wear masks?
So I think it's important to understand why people should wear masks, or really what the purpose of the mask is. And I think there's probably misunderstanding out there about the actual role of the mask. And I will say that I think the full value of the mask is really not completely understood. The guidance that's come out of the Public Health Agency of Canada is a bit soft. They say that you may wear a mask if you're out in public. The real purpose of a mask is to prevent me from shedding virus and infecting other people. So if I'm out in public and I'm in the early stages of the infection, and maybe I don't know yet that I have COVID-19, perhaps I just have very mild symptoms and I don't really recognize that I'm sick yet. By putting on a mask, what that does is it blocks me from shedding virus or spreading virus to other people. That really is the primary purpose of the mask. If I put on a mask and go out in public, I think that the amount of protection that I'm getting from that is actually pretty minimal. So I suspect that there's a lot of confusion about why people should or should not wear masks. Again, if I wear a mask, I'm protecting other people. I'm probably not doing very much to protect myself.
What about putting it safely on and off? I know for myself, I never realize how much I have touched my face before, have to wash your face. So I know you're supposed to wash your hands before you put the mask on, not touch it or wash your hands when you're taking it off. Now, let's say that when you put the mask on, if you haven't washed your hands, does it still benefit you? Like or do you have to be putting it on 100, wash your hands and do all of those proper steps, or else does it kind of negate the purpose of it?
Well, so here's the key. You never want to go anywhere near your face with hands that might be unclean. So we know that this virus can last in the environment, can last on hard surfaces for hours or even days. And so by putting our hand down on a countertop or opening a door, for example, we may have the virus on our hand. The key is you never go anywhere near your face until you've cleaned your hands. And that includes putting on the mask or taking off the mask. Again, if you go near your face with unclean hands that might have virus on it, you can inadvertently touch your eye, your nose, your mouth while you're putting the mask on or while you're taking the mask off. The other thing to emphasize is that after taking the mask off, of course, now your hands could potentially be dirty. And so you want to clean your hands again. It raises a really important point that the mask may provide some benefit, as we've talked about, but it doesn't replace all of the other critical things. Hand washing, hand hygiene, absolutely key. Staying 6 feet away from other people, that's probably even more important than wearing a mask or not wearing a mask.
Okay. So we have a question here from Curtis Harvey. It says, at what number of daily cases will we be able to start opening up? And it looks like he's in Calgary, so specifically in Calgary, or if you can talk for the province itself.
Sure. So we will be making provincial decisions, and that's a really important question. The Premier has announced that he's creating a task force or a working group to look at the relaunch strategy. He'll be heavily influenced and guided by our Chief Medical Officer of Health and by others within Alberta Health and within Alberta Health Services. Together, we're going to make these decisions. Everyone is keen to get the economy going, keen to get out of isolation, keen to get things happening and maybe start to enjoying some beautiful Alberta spring and summer. And we know that people are really interested in that question, but we have to do it safely. We don't want to do anything that's going to compromise the gains and the successes that we've had. We really have done a great job in controlling this outbreak to date, but it's not behind us. We haven't reached the peak yet. And so it's really important that we look at all aspects of this really carefully. And then probably the strategy will be to slowly reopen. I suspect that large gatherings of people will be discouraged for a while, but in time we'll be able to start reopening businesses, small businesses, larger businesses, and then eventually hopefully get back to normal.
Yeah, okay. D. Miller is wondering, how do we know if we're a carrier, if we're asymptomatic?
So thanks, Dean, for that question. Most people who have COVID-19 will develop symptoms. So they may be, of course, without symptoms or asymptomatic for the first day or so. And in fact, we know the incubation period for this virus can be out to 14 days. Most people who get sick with it will get sick within 4 to 5 or 6 days. That's the most common period, 4 to 6 days. So for a day or two before that, of course, people may not have symptoms, may still have the virus. And of course, they don't have symptoms. They don't even know that they have it. There is no way to really know in that period of time that you don't have it. We do know, though, that people who are asymptomatic tend not to spread much virus. They may have it on their hands. You could spread it by shaking hands with people, or it could seed out onto hard surfaces. So the key, again, is the basic measures we've been talking about for a number of weeks now. Clean your hands regularly, because rubbing your eyes, rubbing your nose, that's a way to pick up the virus and shed it to or spread it to other people. It's also a way to acquire the virus. So clean hands, really important, and staying 6 feet away. In the unlikely event that you are carrying the virus and you don't know about it, again, if we can maintain 6 feet of separation, it's extremely unlikely to spread that virus to other people.
I know there are some grocery stores that are starting to do temperature checks on people, voluntary temperature checks. Is that an accurate way to determine if somebody has it? Is that a waste of time?
Well, there are a number of factors. Of course, we see it in airports as well, that temperature screening is happening. The problem is, first of all, a number of issues. What kind of a device is being used to monitor the temperature? Is it accurate? Has it been calibrated? Do we know that it actually works the way that the people who are using it hope that it works? And the other really important thing is that it's just a moment in time. So just because I don't have a fever right now at this very moment does not mean I didn't have one this morning or I won't have one this evening. So I think the temperature checks, it's just one piece of a much bigger picture. It probably doesn't offer a lot, although it's, in the airport screening setups that are being done in some places around the world, it's an easy way to screen a lot of people very quickly, and that's why it's used. In terms of going into a grocery store, probably not really very effective.
Okay. So Tanya says, can you get the test to see if you have antibodies for COVID-19?
Interesting question. And the answer to that is, as of right now, today, the answer is no. However, there's a ton of work going on right now to try to validate and find those antibody tests that will work for us. The problem is you can't just go to the store and buy one of these tests. You can't go to any company right now and buy one because there's nothing currently licensed for use. But there are lots of companies that are trying to develop the test. Our laboratory here in Alberta Precision Laboratories, is working to look at these tests to try to validate the tests. And once we find one that looks like it will give us the answers that we need, then we will start to use that in the population in a number of ways. But it'll be very helpful for us to understand what percentage of the Alberta population has had this infection.
Okay. Amy is wondering, how long before we see a peak? How long do you think this is going to continue?
Yeah, thanks, Amy. So the modeling that had been done and that was released about 2 or 3 weeks ago by the Premier predicted, a couple of things. And depending on how severe the epidemic is in Alberta, the peak, the more severe it is, the earlier it will peak. The prediction was that we would peak in Alberta in the middle of May. Now, I know that those models are being updated, and likely in the next few days, the Premier or other officials will be talking about the modeling. Models are really just a prediction, and you take a whole bunch of information, much of which is a best guess. You feed that into a model, you come up with, again, what will be the best guess. Over time, as we get real information, the models will get to be a little bit better, and we'll be able to see when we can predict that the peak will be happening here in Alberta. We have done a pretty good job at flattening the curve, and it may be that we're not going to see a true peak, that the line is going to be fairly flat. But again, stay tuned, because I think there will be much more information about this coming out very soon.
Okay. So Lisa is wondering, when can I expect to be able to visit and hold my grandchildren again? So I know that kind of goes back to what we were just talking about, and, trying to kind of understand when we'll be able to resume, quote, normal lives, but...
Yeah, we're all asking that very question. When will life get back to somewhat normal? The short answer is we don't know yet exactly. I'm hoping by early July that things will start to ease up and some of our usual typical activities will go back to normal. Within family units, if families are remaining very well isolated and not exposing themselves to other people, the risk would be extremely low. So in that setting, if we have an individual and a partner perhaps who are isolating themselves and then want to be able to visit with their grandchild and the parents of that child, as long as those two families are not exposing themselves to very many other people, the risk is really pretty low. And ultimately, it's up to family units to make a decision, just how much risk are they willing to accept. There's no such thing as zero risk, but I think the risk could be very, very low. Of course, they can certainly visit, and even now, if they choose to, stay 6 feet apart. Of course, I know that doesn't allow them to hold their grandchild, and that's what they really want to do. So I hope that the recommendations and public health orders coming from the Chief Medical Officer of Health will begin to ease off in the next few weeks.
Okay. So Lisa is wondering, what are the chances of another outbreak, and will the people who had it get it again?
So a couple of questions there, Lisa. Thank you for that. So the first part is, can you get the infection again? And we still don't know the answer to that question. We are watching very carefully for information that's emerging in other parts of the world. We really need to understand, after you've had COVID-19, are you immune to it? How long will that immunity last? Will you be prevented from ever getting it again? And we just don't have the answers to that question. So stay tuned, and hopefully we'll have it soon. The other part of this is, will there be another peak? And again, there are some predictions that we may have another peak, but we just don't know that for sure. Now, that's really based on experience that we've had in the past with a totally different virus. The influenza virus, we know, does come in waves, and some of your viewers, no doubt, will remember the 2009 pandemic with H1N1 influenza. We had an outbreak, a peak in the spring of 2009, and then we had a much bigger peak in November, the fall of 2009. Whether that's going to happen with COVID-19, we really don't know yet. It's a different virus completely, so we don't know exactly how it's going to behave. So again, all I can say is stay tuned. I hope that that's not going to happen, but we really don't know yet for sure.
Yeah. Okay. So Morgan is wondering, has anyone with lupus had COVID-19? This one's tough. If so, did they live? She has lupus, and she's been worried as to what would happen if she got it.
So that's an interesting question, and I can't say absolutely for sure, but lupus is a relatively common problem in the population. There has been enough COVID-19 circulating again around the world that I have no doubt there must have been individuals with lupus who have had COVID-19. Now, lupus is a very broad spectrum of potential illness, And it depends a lot on what medications an individual might be taking for lupus. The lupus itself, of course, is one problem, but some of the medications might further suppress the immune system. That would make an individual at higher risk. So the short answer is undoubtedly there have been individuals with lupus who have had COVID-19, and I am sure that most recovered from that, but I can't say specifically.
Right. Okay. So Jasmine is wondering if you have an update on when elective surgeries are going to resume.
So this is part of our planning, and when can we start to reopen health services? When can we start to reopen stores and businesses? This will all start to come together. We know that this has been a problem for Albertans and for Canadians and others, that the delay in elective surgery that they were waiting for, that they were planning for, has been put off, and I know that it's a hardship, and we really do want to get back to offering a full spectrum of health services, but we need to be sure that when we do that it will be safe. I suspect that what we'll start to offer is the day procedures, so procedures that don't require a stay in hospital, that will preserve our hospital capacity in case we need it for COVID-19, will allow us to start performing some elective surgeries to, again, address some of the health needs of Albertans. So stay tuned. I think we're probably still a few weeks away from that, but hopefully in the next few weeks there will be a plan that will be announced to start offering some day procedures.
How do you determine what happens first? So I know that, people want to go and start visiting with people, but at the same time, to have elective surgeries, it just seems, how do you make the decision as to kind of what I'm going to use the word what you risk first, right? Because not knowing if people can catch it again, what the spread will be like, if there's going to be another peak. How is AHS planning for this and just saying, okay, we're going to kind of try something, and if that's successful, then kind of how do you prioritize what's going to be the first thing to resume?
So those are really important questions, and there's no easy answer to that. I mean, you can't just go and pick a book up off the shelf and look up the answer to these sorts of things. You can't even search the world literature at the moment to find the answer to these things. So there are a number of things that will factor into how we will relaunch and reopen the services that are currently closed. First of all, we're getting some guidance from the World Health Organization They are offering some recommendations to countries. The Public Health Agency of Canada is looking at that guidance and developing their own guidance. In turn, Alberta Health and our Chief Medical Officer of Health and Alberta Health Services watch carefully for guidance from the Public Health Agency. At the same time, looking globally to see what's happening. Germany is beginning to open some of its services. Other countries are doing the same. So we're watching carefully what the experience is in other countries, and that will provide guidance to us and will give us some direction as to how we might do it safely. I think we could predict that large sporting events will probably be the last thing to come back, at least in terms of having huge crowds, similar with concerts. So I think we'll certainly see the huge congregations of people. I think that will be the last thing that will happen. But we can start to do things that don't bring a lot of people together, start offering, letting small businesses open, and then larger businesses. Of course, looking then at the same time really as at the health system. What services can we start to open and to offer safely that will minimize the number of people that get together all at the same time, while also ensuring that we preserve our health system in case we need it, in case there's an increase in the number of cases. So multiple factors coming together to help us decide what health services to open, to start to offer. Similarly, what services in the community can open and can start to offer services to the population.
So you mentioned Germany there. Aneda and Tracy have a question about the borders within Alberta. So the first question is, what are your thoughts on Saskatchewan opening up slowly as our cases rise? There's still a lot of travel going on. And then Tracy wants to know, is there any talk of closing provincial borders?
So I would have to leave the decision about provincial borders to the Premier. And I understand he does have authority to close borders, but to be very frank, I'm not sure if that's a provincial or a national decision, but I think the Premier believes he does have the authority to close the border if he felt that was a necessary strategy. Of course, I don't think that's ever happened before. How exactly would we do that? So all of those things would have to be worked out. We're watching very carefully how this pandemic is unfolding in Alberta and making decisions to protect Albertans. There will be many decisions to come. How do we reopen services? How do we restart our healthcare system? Saskatchewan and British Columbia on either side of us, of course, they're making their own decisions and will continue to do so. British Columbia is reporting that their the number of new cases that they're seeing is slowly dropping. So they'll start to make decisions about restarting their health system, their economy, and Saskatchewan will do the same. And how we'll link together, I think, remains to be seen. I will say that there are daily conversations between the chief medical officers of health between the various provinces. So they are working very closely on these items and will continue to do so. Again, we all want to see things open up. We want Albertans to have access to health services, to businesses. We want them to be able to go back to work if they've been off work, but we need to do that in a safe way.
This next question, it's kind of twofold here, and it deals with some of the issues that we have been seeing with COVID-19. So Starla says, my husband works at Curl and I work at an AHS hospital. When he comes home, he is expected to isolate for 14 days. What is the expectation for me as an AHS employee?
Yeah, that's a really important question. You know, it's impossible to track exactly who works where and who's married to who and who might be sharing within 6 feet of space with other people. I would suggest that if that individual has been working in a work camp where there's an ongoing outbreak, if he's been exposed to other individuals who might be sick, when he comes home, he really should remain 6 feet away from anybody else. If the house setup or the living arrangements allow it, he should have his own room, ideally his own bathroom, and really should remain 6 feet away from anyone else for 14 days in order to absolutely prevent any spread to anybody else. When we're talking about healthcare workers who go to provide service within hospitals, of course, the last thing we want is for our healthcare workers to come into hospitals sick and then potentially spread infection to people who are already vulnerable within our hospitals or our continuing care facilities. So it does give me an opportunity to say that as of a couple of weeks ago within Alberta Health Services, we made the decision that all healthcare workers will be continuously masked while in the facility and while providing healthcare. The reason for that is that we know that there can be healthcare workers who come to work who might have been exposed to COVID-19 potentially in other settings, maybe even the home setting, as was just mentioned. They're not feeling ill, or perhaps they're just starting to develop symptoms but don't recognize yet that they have the illness. They come to work, and we absolutely want to prevent them from spreading COVID-19 either to patients or to their coworkers. And so for that reason, we have introduced a continuous masking policy for all healthcare workers in working within Alberta Health Services.
Yeah. Christine wants to know, just speaking of masks here, she says, so Christine says, when can we expect better PPE back to our previous standard?
So I'm not sure exactly what element. So PPE stands for personal protective equipment. There are multiple components of personal protective equipment. So it includes masks, it includes fit-tested N95 respirators, it includes gloves, it includes facial protection, either full face shields or goggles, it includes isolation gowns, in some settings might even include scrub uniform type items. So there are many items, many elements there. I think it's good to emphasize that there is intense global demand for all elements of personal protective equipment. These are truly unprecedented times. And so there is massive global demand for gloves, for masks, for N95 respirators, and for all the various elements of personal protective equipment. Within Alberta, we've actually done an incredible job. We have a remarkable team within our procurement services to source personal protective equipment from all over the world and to access the items that we need. So I think perhaps this question relates specifically to a type of mask that has been brought in recently to Alberta Health Services. There has been some concern about the mask. That specific mask absolutely meets all standards and requirements, but there have been some challenges with using it. And the biggest problem is that the nose piece is a little bit different than what our healthcare workers have been used to in the past. It doesn't mold to the shape of the nose as easily as the mask that we have been used to in the past. I will say that we've just put out some little teaching videos within Alberta Health Services so that our healthcare workers can see that there is a simple little trick that can be used that does mold that mask better to their nose so that the mask will fit and will sit properly and more securely on the nose and on the face so that it doesn't move around. Again, these are incredibly unprecedented times. It's difficult to access sufficient amounts of personal protective equipment. We've done an incredible job within Alberta Health Services, but this does mean accessing from supplies from manufacturers that perhaps we've never utilized before. The equipment is new. It works a little bit differently. It does take some getting used to, and some of it simply is just not the same as what people have been used to, and we do have to work through all those challenges.
So you mentioned a resource for AHS staff with the mask. So this next question has to do with another kind of resource. So we've actually had quite a few questions about certain pre-existing conditions in relation to COVID-19 and how they can impact whether or not someone gets it, the severity of it. So instead of going through all of those, is there a resource that people can go to in order to have those questions answered? So things like if someone has celiacs or fibromyalgia, mental health issues, things like that. Is there a resource that Alberta Health Services has where you can point them in that direction?
So I haven't looked just recently, but I think if you go to the Alberta Health Services site and look for COVID-19, or if you go to Alberta Health, so that's what is the website address? I forget offhand, but it's if you go to the Government of Alberta, you'll see right away that there's a COVID-19 website. If you check those, I think you'll find the information that you need. There are a couple of things I would emphasize. Having a chronic health condition does not make you any more likely to catch COVID-19. Catching COVID-19 takes direct exposure to somebody else who has it. So that has nothing to do with what your underlying health issues might be, whether you're perfectly healthy, whether you have chronic disease. That it has nothing to do with whether you actually acquire COVID-19. What we do know is that if you do catch COVID-19 from somebody else, and if you do have certain types of chronic health conditions, so that would be particularly chronic lung disease, chronic heart disease, high blood pressure, diabetes, and perhaps a variety of immunosuppressive drugs that suppress the immune system. If you suffer from one of those conditions or are on drugs that might suppress your immune system, and if you then catch COVID-19, then on average, you'll tend to have a somewhat more severe case of COVID-19 compared with someone who's young and healthy and has no chronic illness.
Jennifer's wondering, how are you determining their covered cases? So are you following up with people's health?
So we know that most individuals with COVID-19 after 10 to 14 days after onset of the symptoms, they've usually returned to pretty near normal health. Sometimes fatigue will last a little bit longer, but most of the respiratory symptoms, the cough, the shortness of breath, the runny nose, the sore throat, the fever have all gone within 10 days to 14 days. And so we, on average, we know that if we wait 14 days from the time that an individual had a positive test result, they are typically cured and can go back to their usual activities. So in monitoring the cure, it's really There's no formal way of contacting individuals 14 days after their test to say, are you 100% today or not? But we know that most individuals after 14 days will be back to their usual state of health.
Paulo is wondering, so Calgary at this point has, he says about 70% of the cases. I'm not sure if you can verify that, if it is about 70%. So is there any intention to further restrict people in that city?
So that is right. Calgary does have the majority of confirmed diagnoses with COVID-19, and it would be around 70%. There are a couple of reasons for that. Calgary began the outbreak a little bit earlier and had more intense COVID-19 activity, mostly in the early timeframes related to international travel, people coming back from the US and other places with COVID-19. So that began the outbreak in Calgary. Of course, for each individual who perhaps came back from travels with COVID-19, each of those individuals may have spread it to other individuals. So, of course, the outbreak began in Calgary earlier and involved more people earlier on. Now we're also starting to see that there's a very large outbreak in High River, just south of Calgary, that is part of the Calgary zone. So the numbers from that community would be included in the Calgary numbers. Of course, we're seeing a very large outbreak related to the Cargill meat packing plant. And it's not just the plant, it's people who work there or are connected, family members, or have other connections to people who do work at that meat plant. So that's quite a large outbreak that's also contributing to the numbers in Calgary. The recommendations would be the same. It's a matter of trying to diagnose those with infections. So we're offering testing to anybody with any symptoms. So we're trying to confirm who has COVID-19, who does not. After confirming that someone has COVID-19, we would recommend that they isolate themselves, socially distance themselves from anyone else for 14 days in order to try to protect anybody in their household or anybody at work. We also begin intensive contact tracing. So we try to find out who might they have been in contact with during the time that they were ill and just before they became ill, so that we can also recommend that those individuals isolate themselves and keep 6 feet away from anybody else. So these measures, we know that they work. They take a lot of work, a lot of activity, and these are pretty intensive activities to try to reduce the spread of COVID-19. We're looking even now at the possibility that some individuals who might live with many other individuals in the same household, we might need to physically separate the sick individual or perhaps the healthy individuals, put them into different living accommodations, again to try to keep the sick individuals away from the healthy individuals and to try to reduce spread and reduce the overall outbreak that's occurring.
Yeah. So Krista is wondering, and this applies to basically the whole province, she's wondering why we haven't shut down food delivery services. She says, I feel there's a lot of interaction for one delivery driver between multiple people.
So I think that the food delivery service can be done safely. I can't speak to the exact scenario that your viewer might be commenting on, but food delivery service, for example, where the payment is done online, the ordering is done online, the food delivery maybe drops the food off on the front porch. There's no direct contact with anybody. That would be very safe. We know this is not a foodborne illness, so we're not concerned that eating the food might be transmitting COVID-19. The packaging theoretically could have virus on the outside packaging. So, of course, we would recommend that you remove the food, remove from the packaging, and then clean your hands before you eat. That would be just good standard advice in time. But the actual food delivery service, I think, can be done very safely.
This is for parents are wondering about this. So Benita is asking, can you give us some clear advice for parents regarding allowing their kids to get together with friends?
Yeah, that's a really good question. And we know that the impact of COVID-19 is really it's huge. It's huge on kids. It's huge on families. The socializing aspect of childhood, and really the socializing aspect for our seniors is really a big problem, because of course we're trying to minimize it, but that does have other effects. So, Dr. Hinshaw, our Chief Medical Officer of Health, offered some really good advice a couple of weeks ago that families can consider themselves a cohort family. And what that really means is that if we have two families, let's say two households side by side, neighbors, just as an example, if they choose to self-isolate, so they have no contact with anyone else, no direct physical contact, in other words, keeping 6 feet away, and if those two households really have no contact with any other households, they could have contact together. So the kids from two neighboring houses, or the house across the street, or perhaps in a block away, or a neighborhood away, I mean, they could choose together as two families to restrict their contact with others, and then they could have contact together. If I don't know if I've made that very clear, but hopefully the concept comes across, that it's physically distancing and separating ourselves from others that restricts the spread of this virus. And certainly two families, even three families together, could commit to isolating themselves from the outside world effectively, and then they could share space together.
Okay. Questions here. So Julie's wondering, is there a reason why Alberta has now doubled the infected from BC?
Thank you, Julie. I wish I had a good answer to that. Again, we know that the way that this has evolved in Alberta, it's slowly evolved. We've had some recent upswing in the number of cases directly related to a couple of large outbreaks in communities south of Calgary, as I just talked about. Again, that's reflected in the Calgary numbers overall. So that is an ongoing concern, a big concern actually for us here in Alberta. British Columbia, of course, they've had their own challenges, which they've managed to control, and they're now starting to see their numbers come down. In Alberta, we have seen a recent upswing. Overall, let me emphasize, our numbers are still relatively small, and we're still relatively lower than what we feared we might be at this point in time. Now, that doesn't mean we can become complacent. We've done a great job, and I'm very proud of Albertans that have gone to great lengths to physically distance themselves. They followed the public health guidance really closely and carefully. We've done a great job at slowing the spread of this virus, but we do have some challenges right now that we need to get under control. And again, that's specifically a couple of communities south of Calgary.
So I think, so there's some questions that kind of relate to each other here, and I think you have gone through them. So I just want to summarize here. So Dolores is wondering, for traveling to other provinces, she has elderly parents in Ontario, and she would love to go and help them out. So is that a situation where, if they did, like you say, like the cohort family, that if she were to go from Alberta, go stay with her parents in Ontario and help them out, as long as they followed the guidelines to social distance, then is that something that she could do?
I think she could do it if she, I think she could do it. The thing to consider is, do her parents need her help? Obviously, I don't know what her situation is, or her parents. Yeah. So do her parents need her help? And if she truly believes that they are in need of help, then there are risks to not providing that help. There are certainly risks to traveling and to offering the help, but ultimately it's a matter of weighing the risks and trying to decide what is the best course of action for that individual family setup. So there's no question, if she's done a good job at physically isolating and distancing herself from others, if she's confident that she has managed to stay infection-free, she could certainly go to Ontario, help her parents. She might want to stay physically separate from them for the first 10 days or so while in the household with her parents, and then there would be no risk after that.
Okay. So you just somebody else. I'm just going to ask this one more question here. So Asawari says, do we expect the virus to evolve and become less dangerous?
Yeah, that is a really interesting question. And again, we don't know the answer. We can offer predictions. The coronavirus family, which this virus belongs to, is a fairly large family of viruses. There are 4 members of that family that cause the common cold in humans. And we see them all the time, every year. They're very common causes of the common cold. This is a new strain of coronavirus. It probably emerged from animals, spread to humans. We've never seen it before. This is why it's causing such a large worldwide outbreak. Over time, it may be that this virus will gradually evolve, change, mutate, and will become the 5th member of the coronavirus family that we know can cause routine common colds. That would actually be my hope. That would be probably the best case scenario, is that that's how this would evolve and eventually, and this is eventually what would happen, but we just don't know yet whether that's the case. Of course, at the same time, we're hoping to develop a vaccine in order to protect all of us from infection with this particular virus.
So this is actually a comment that someone has. First of all, actually, fun fact, you have quite a gathering of fans, apparently. Someone asked if you were single, so you have gained quite a following through all of this wonderful information you've been providing. And this comment comes from Doug. He says, "Thank you, Dr. Mark Joffe, for keeping Albertans informed. No questions from me, but I'll share this on my Facebook. Thank you for tackling misinformation and conspiracy theories." So you are definitely making a difference within Alberta, and I really hope that that you find this beneficial too, so that you kind of know where Albertans are coming from right now.
This is fantastic. First of all, thanks so much for those comments. Those are really wonderful comments. I'll have to ask my wife if I'm single. She'll probably say no. so that'll be the answer to that question. But you know, I love the opportunity to hear from Albertans, to hear what's on top of mind for Albertans. What do they want to know? There is a tremendous amount of misinformation out there. Be very cautious just surfing the net and reading what Jim has to say, and you have no idea who Jim is, or Bob or Sarah or whoever. Just be a little bit cautious. There's a lot of misinformation out there. There are conspiracy theories out there. Just, again, be a little bit cautious. Try to stick with reputable sources. Hopefully I'm a reputable source. I'll tell you the straight facts as I know them, as I learn about this. Of course, you know, this whole problem of COVID-19 is only 3 or 4 months old, so we're all learning, and there will be much more to learn. And I love the opportunity again to hear the questions directly from Albertans and to be able to provide some information.
Thank you so much, Dr. Joffe. I really, really appreciate you taking the time for all of our questions, the variety of them, and yeah, getting that information out there. I know we have taken a lot of your time today, so we will let you go. Thank you so much, and hopefully we'll get to talk to you again soon.
I'll look forward to it. Thank you so much, and thanks to your viewers.
Thanks.